Facing discrimination in health facilities is not unique to transgender people. Richichi, an organization representing people with HIV, recently surveyed 9,000 people from population groups with high HIV infection rates. Researchers asked them about their experiences at hospitals and clinics. With me to discuss that is James Oladipo, one of the authors of the report. James also works for the Treatment Action Campaign. James, thanks for joining us. Which groups of people did you survey?
Thank you for having me. Yes, we key populations, which includes people who use drugs, sex workers, transgender people, and gay, bisexual, and other men who have sex with men.
So if you were, for instance, a drug user or a transgender person, were you refused care?
Yes, out of the people we interviewed, at least 12% of the interviewees were refused services. And the most highest number of people that were refused services were amongst people who use drugs. Next, transgender people. There were about 9% of the trans people that we interviewed that were refused services. And the sad part is that majority of those people that get turned back or refused access never got services anywhere. So they end up just going home or just leaving with whatever issues that they went to the facility to resolve.
We've spoken about health workers, but what about other staff at hospitals, for instance, security guards or porters? Did they discriminate against these populations as well?
Clinical staff were, the nurses were top on the list of those that were being unprofessional and disrespectful to staff. But then coming after that is security guards, because you should know that security guards are the first point of call when people access the healthcare facility. So security guards, and again, like, cleaners were also people that key populations found that they were discriminatory and disrespectful. You have issues like key populations like trans people being denied access to bathrooms, telling them, oh no, telling a trans woman that you're a man, you should go use the men's bathroom.
If we look at the consequences of such treatment, what is the effect on those patients' willingness to then seek treatment after such an incident?
We discovered that quite a number of key population also no longer access healthcare services anywhere, which means they've disengaged from care, they do not access preventative services anywhere. They've just decided not to go because they can no longer take such disrespectful and feeling unsafe in the healthcare facilities. So issues like that are some of the consequences or repercussion of this discrimination. But also on a national level, we as a country, this also affects the HIV response, because key population are the vulnerable people that are much at risk of HIV infection. So if we leave key population behind, then we are losing in our fight against HIV.
James, let's move on to solutions. How do we fix this?
Again, this year we've asked that the National Department of Health establish 2 centers of excellence, 2 specialized clinics in each district per key population group. So what this means is that a clinic where each key population can go to in their district, where they can get a full package of services that they would require, and also plan patient transport, because we know districts are vast. So there are issues around key population not being able to access this clinic.
James, can you give us an idea, if you say a full package of services, say for drug users or for transgender people, what would those packages look like?
The responses to a person that uses drugs is different to a trans person or to a gay person. So, for example, for a trans person now, they will need a clinic where they have access to contraceptives, access to hormonal therapy, access to counseling, access to post-violence services in a space that is respectful and non-discriminatory. For a sex worker, they will need a facility that provides services like post-violence services, contraceptive, post-exposure prophylaxis, where they will get offered PrEP every time they go for HIV testing.
Do you think the health department has the resources to put those up?
Well, based on the commitment or the presentation that we've listened to about the specialized clinics, there will be one specialized clinic in each district for all population group. But we are saying that is not enough because you cannot train people and create services for every population group in one clinic. It is just too limited, and we would like to see at least two.
Talking about access, your study also found that over 60% of transgender people wanted to have access to hormone therapy. Is that available at government clinics, or is there a problem?
Hormone therapy is not available in most healthcare facilities, only in the bigger cities. So what our study found out was that 63% of trans people wanted to access it would like to access it at their public health facility, because then it's closer to them. It's where they go for their basic healthcare. So it would be ideal for them to be able to access it there. But what we also found out is that 43% also were not even provided the information on where to access it.
James, thanks very much for your time today. That was James Oladipo, one of the authors of Rishichi's report on the state of the healthcare of key populations.